Hi everybody, welcome to iCode Academy again. This is the second video in the Evaluation and Management Coding series, and today we're going to be breaking down the exam. All right, let's get started. There we go. So the exam, this is going to be the second of three key components when it comes to our E&M documentation and coding or evaluation and management. The first one, if you tuned into that video, was discussing and overviewing the history. Sorry about that. So this is going to be an objective finding from the provider. This is where the provider is examining the patient and documenting everything they find positive that is pertinent, as well as negatives in the exam. There are going to be two sets of guidelines here that we're going to talk about. Our 1995 Evaluation and Management Guidelines, as well as the 1997 guidelines. Overall, we do have 4 levels when it comes to our exams. We have a problem-focused exam, expanded problem-focused, detailed, and comprehensive. So let's break that down and talk about what this looks like. So again, when we're talking about our evaluation and management guidelines, there's 2 rules or 2 sets of guidelines we can go by. 1995 is going to be the most common. This is the one I'm going to spend the most time on in this video. If you are using 1997 guidelines, you are usually a specialized coder, maybe working in ENT or neuro. Typically, this is not seen in general, primary care or pediatrics. So we will touch on 97 guidelines today, but mostly we'll talk about 1995. All right, let's talk about the key differences between the 1995 Evaluation and Management Guidelines and 97, specifically when it comes to the exam piece. So you can see here that the 95 guidelines has 7 different body areas as well as 12 organ systems that are recognized. This is typically your general multi-organ system type of exam. And again, like I said before, it's the most common set that we're going to be using as coders. It is completely acceptable for a provider to document or use the word, normal, what is relatively normal when it comes to the exam findings. And the rules overall are about 1.5 pages, pushing 2 pages. In contrast, we have our 97. Here you can see we have a total of 14 organ systems and no body areas that are recognized under this set of rules. There's 1 general exam as well as 10 very specific specialty exams under this set of guidelines. This really has highly defined elements which are found within the exam bullets. And we have about 34 to 35 pages of rules and guidelines. When you're working on leveling out or coding for evaluation and management services, make sure you're paying attention and ask yourself, am I going to be using and following the 1995 guidelines, or am I going to be using and following 97? The reason you need to ask yourself this is because once you start using a set of rules for an encounter, that's going to be the set of rules that you'll stick with and follow for the entire counter. You're not going to be like going back from 95, 97, and back and forth. You can't do that. It's not allowed. So pick a set, whatever is appropriate for the type of counter or the provider that you're coding for, and stick with it. So let's dive into 1995. Here I've included the 7 body areas for you, as well as the 12 organ systems. And we'll look at those more in depth. As well as elements that we might see in the documentation to support these areas. But starting with the body areas on the left-hand side, you can see that we've got the head, which includes the face, neck, the chest area, which is going to include the breasts, abdomen, the genitalia region, which includes the groin and or buttocks. We have our back and spine, and then our extremities, so our hands, feet, one or both. Next, we have our 12 organ systems. Constitutional is going to be, just like in our review of systems, that general, how are you feeling, any weight loss, weight gain, as well as our vitals, but we'll talk about that a little bit more here in a minute. We've got eyes, ENT, cardiovascular, respiratory, we have our GI and GU, musculoskeletal, skin, neuro, psych, and then we have our hematological, lymphatic, and immune system. All right, so let's talk about that constitutional. Constitutional is going to be our very first or one of our organ systems that is acceptable underneath the exam guidelines. This is really going to be the general overall appearance of the patient, including developmental as well as maybe just general hygiene and grooming habits. Provider might also document vitals such as blood pressure, respiratory rate, temperature, height and weight. These can all be elements that you'll find in the documentation to support the constitutional system for the exam. When we look at our sample documentation here, you can see that we have some vitals documented. One thing I want to give you a little heads up or as a tip as a coder, when you see the vitals, make sure that you have at least 3 separate vitals documented. This is what is necessary in order for us to count vitals as a constitutional element. So if a provider only has height and weight, we can't take this as a constitutional. If they have height, weight, and respiratory, or height, weight, and blood pressure, we have our 3. We can go ahead and count this then as a constitutional system for the exam. So just something to kind of keep in mind when you're working through those. Next, we're going to go over to our body area and talk about head, which includes the face. Provider might be checking for lumps, swelling, seeing if the face has any abnormalities. Again, the medical necessity, just as we discussed within our last video, is completely up to the provider. It's your job and your role as a medical coder to pick out those elements and make sure that we're counting them up or attributing them appropriately. Next, let's talk about the skin. Some of the elements that could be coming up in a skin exam is any rashes or lesions. Also, checking the patient's hair and nails, seeing if there's any discoloration or breaking or any other abnormalities. Here we can see that we have some documentation that is something I've seen where the provider is saying that the patient's face is flushed, the skin is normal, and there's no rashes that are noted. Let's talk about our eyes next, the window to our soul. All right, so eyes. This is going to be a visual inspection of the conjunctiva as well as the eyelids. Providers are typically using an ophthalmoscope, which is the little handheld with the light where they can look in the eyes as well as your ears. They may be looking at the optic disc as well as the posterior segments within your eye, or checking for any yellowing or jaundice. Some of the sample documentation that you'll commonly see for an exam is PERLA. So this is the provider checking the pupils, noting that they are equal, round, reactive to light. Also maybe noting that the sclera or the white part of our eyes is in fact white or maybe red, and that the conjunctiva is pink. Again, these are typical findings or quote unquote normal findings. So depending on what the patient is being seen for, they might have other findings. All right, next system on our list is going to be our ears, nose, mouth, and throat. So even though this is multiple areas in this region, it is all overall encompassing one system. So make sure that we keep that in mind and we're not counting this as more than one system. It is not necessary for the provider to do the ears and the nose and the mouth and the throat. That medical necessity is up to the provider. So if they do one of them or all 4, they do get credit for the entire system. Again, as coders, let's look for that documentation, read it, interpret it, and give them the appropriate credit. So here we can see that a provider may be checking for the external appearance, maybe any lesions, masses, or scars. Also could be noting the nasal mucosa, checking for any swelling or redness. And here below you can see some sample documentation as far as the TM, TM is a common abbreviation for the tympanic membrane. Also checking that EAC, or the external auditory canal. So again, this is just some of the documentation that you may see associated with this system. Not an all-inclusive list by any means. All right, let's talk about the neck. Let's think about that. Neck. Was that a body area or an organ system under the 1995 guidelines? So neck is going to be a body area. So we're kind of flipping back to the other side now. So neck provider typically checking for any lumps or overall swelling. Documentation could note that the neck is supple and there are no masses present. Next body area we're going to talk about is the chest and breast region. Providers may again be checking for tenderness, lumps, noting if there's any masses or discharge present. All right, let's talk about our genitalia region as well as musculoskeletal. Obviously, depending on if the patient is male or female, the extent of the genitalia, groin, and buttocks examination is going to be different. Some of the documentation that you may see is providers noting if there is any discharge, any masses present, any overall tenderness. Musculoskeletal. Let's talk about that one. This is going to be our muscles as well as our skeletal system. Here, providers are typically checking for range of motion. So range of motion is it the extent of the range of motion within a particular area. So, are you able to extend your arm fully? Can you fully reach up or bend all the way over and touch your toes? That type of thing. Some of the documentation that you may see here is noting the overall strength and tone of the upper or lower extremities, indicating if there's a good range of motion or maybe it's impacted or limited, as well as noting if there is any deformities within the joints. This might be your hands, wrists, or within your feet. All right, respiratory system. Really big system here. Very common to see this within all types of encounters. Here, provider may be listening to the rhythm as well as the rate and depth of the respiration. Also noting the effort. Is the patient's going through a lot of effort, or is they're breathing very labored? Also noting any sounds within that breath. So is there a wheezing present? Is there kind of like a railing sound going on in there? And some of the documentation you might see is the provider noting the osculation is clear. There might be wheezing present, or listening for any rhonchi or rails. Next one we've got here is neuro and psych. So neurological could be checking for a wide range of things. Typically, it's sensation. Provider doing an exam and seeing, can you feel this? Can you feel me touching your fingers, your toes, the side of your face, that type of thing. Also checking for the cranial nerves and reflexes. Sample documentation you might see is no neurological defect, weakness, or paralysis. Psychiatric for the exam is very similar to what we talked about in the review of systems in the last video. Assessing the patient's mental status as well as their overall mood and effect. Very common for you to see alert and orientated ×3, or sometimes abbreviated as O&A ×3, or letting us know that the patient is coherent and has good or appropriate insight. Another big one, cardiovascular. Think about that. Cardiovascular. Are we in a body area or an organ system as far as the 1995 exam goes? All right, I think you're on the right track. Organ system. Okay. This is where they are talking about the heart and its the valves, the pumps, the arteries, everything that takes care of our heart and keeps us going. So here we might be seeing if the provider is assessing a rate as well as the rhythm. Are there any murmurs? Is the heart skipping a beat? Is the heartbeat too slow, too fast? That type of thing. All right, GI and abdomen. So right off the bat, you might be thinking, wait a second, that's two. Abdomen is a body area. GI is an organ system according to 1995 guidelines. So why does she have them included together here? The reason is the two of these are commonly used interchangeably, not only between coders, but providers from my experience. So we want to make sure, again, that as a coder, we are reading the documentation and giving them the appropriate credit or leveling it out correctly for our E&M services. So let's talk about the abdomen. The abdomen is a technical term for our stomach. Just that, just the stomach muscle that holds our food and processes and breaks down that food. Okay, so an exam as far as just the stomach, just the abdomen is a body area. Once we go over to GI, we're in an entire organ system now. So if the provider's documentation shows elements of only them examining and documenting that the stomach was examined, you're going to give them credit for abdomen. So this will look like abdomen is soft, non-tender, non-distended, or distended. So it's kind of pushed out or it's swollen. That's your abdomen. That's just your stomach. But once they start talking about bowel sounds, so our bowel sounds are happening in our intestine. Or if they talk about a liver or a spleen being enlarged or no omegaly, so it shows no enlarging, they've now left just that stomach region and expanded into the surrounding organ systems. So this is going to be a GI exam. When I taught physicians, I always told them, as a coder, my job is to look at the documentation that you give us and interpret that correctly. Some providers will use abdomen or GI as like a header within their documentation, but then the documentation of the exam itself may be contradicting. What you want to do, again, as a coder, is make sure that you're looking at the documentation they gave you for the actual exam, not the header. I mean, the header could say happy birthday or Merry Christmas. That doesn't mean that they didn't do the exam. So again, regardless of what the heading looks like or the category or how it's titled, let's make sure we're looking at the actual exam findings and attributing those to the appropriate body area and organ system, if that makes sense. All right. So let's put that all together as far as 1995 is concerned. Excuse me. So our overall 4 levels, again, is going to be problem focused. We've got expanded problem focused, detailed, and comprehensive. So how many elements or body areas and organ systems do we need for problem focused? Well, let's take a look at the chart here. We only need 1 body area or 1 organ system when we're talking about a problem focused exam. When we're talking about comprehensive, let's move all the way down to the table now. This is at least 8 or more organ systems. So please pay attention that for a comprehensive exam under the 95 guidelines, you cannot use body areas. That doesn't mean the provider can't examine a body area. They can. We just can't count it when it comes to leveling or justifying the comprehensive, lost my train of thought there, sorry. The comprehensive level as far as the exam is concerned. So they might have 8 in total, 7 of them are organ systems, and 1's a body area. We can't justify comprehensive because we don't have at least 8 or more organ systems there. All right, so let's go to expanded problem focused and detailed, the ones in the middle. Why did I skip those? You'll see here that it says typical. Typically, expanded problem focus is 2 to 4 body areas or organ systems. Detailed is typically 5 to 7, again, body areas or organ systems. The reason that I skipped over these initially and I put typical there is depending on the organization or the region that you work for, their guidelines on expanded problem focus and detail may be a little askew. For the purpose of this video and discussion, we are going to go with 2 to 4 and 5 to 7 because that's generally the norm across the board. But again, as a coder, let's make sure we're double checking the rules and regulations in the area and the system that we work for and making sure we're cognizant of that. All right. Again, a few notes when we're talking about 95. As a reminder, this justifies, or the 95, justifies and allows body areas and organ systems. The medical necessity piece is always up to the provider. So what I mean by medical necessity is what is needed, what is required. As far as how much exam they do, that's up to them depending on what they see fit. It is instructed that they are documenting positive or abnormal findings within the documentation. And if there's negative or normal findings, they can go ahead and use that term negative and normal. So let's compare the 95 and the 97 guidelines. Again, you can see here on the left side of your screen, we still have 4 levels: problem focused, expanded problem focused, detailed, and comprehensive. That doesn't change between the 2 of them. What changes between 95 and 97 guidelines for evaluation and management services are the details that justify those 4 levels. We just reviewed in detail the 1995, and here we can see the 1997 actually accounts for elements from specific systems rather than the number or amount of various systems that have been examined. All right, so working with our 95 rules, let's look at a problem-focused exam. Very minimal. Our required elements, again, is 1 body area or 1 organ system. You can see here that we have constitutional, NAD. What does NAD mean? No apparent distress. So the provider gave an overall appearance for the patient as well as some vitals. We have our blood pressure, HR is our heart rate, and resp is going to be our respiratory rate. So we have more than 3 vitals. We can go ahead and count this as a constitutional organ system. So let's make sure we check that off. And that's all we need. Very minimal, very simple to support a problem-focused examination under the 1995 guidelines. All right, second level, expanded problem-focused. Again, we're going to go ahead with the 2 to 4 body areas or organ systems for the purpose of this discussion. We have, again, our constitutional from our previous slide, as well as GI. Well, let's make sure we're reading the documentation and not just saying it's GI because that's the heading they used. Let's make sure it's actually GI instead of abdomen. So reading the documentation, provider notes bowel sounds, which again, our bowel sounds happen or occur within our intestines, no organomegaly or no organ swelling, as well as the abdomen being soft and non-tender. This is perfect documentation and just what we need to support a GI organ system. And that's it. We have 2 organ systems, and that's all we need for an expanded problem-focused exam. All right, level 3 under the 1995 evaluation and management rules and guidelines. Here we have our detailed level. Here we need 5 to 7 body areas or organ systems. So let's take that constitutional and GI just like we had in the last example. Now we have skin. Provider says that it's warm with no lesions. All right, let's check that off. We have CV, cardiovascular, normal rate and rhythm, no murmurs heard. All right, I'm going to mark that one. MSK, musculoskeletal, normal gait and station. Got it. And last, neck. Midline normal, no masses present. All right. Well, it looks like I've got some organ systems and body areas. Can I do that for a detailed exam? Yes. 100% acceptable with the first 3 levels. You can see here that it's 5 to 7 body areas or organ systems. So when we count them up, we've got neck, which is going to be 1, constitutional 2, cardiovascular, musculoskeletal, GI, and we have skin. So we are at 6. All right, that's all we need. Last level is going to be our comprehensive exam. This is 8 or more organ systems. All right, let's see if we got it. Constitutional, GI, skin, cardiovascular, musculoskeletal, all examples we had before. All right, psych, A and O times 3, alert and orientated. All right, eyes, we got that, and lungs, clear. All right, when we count them up, we have 8 organ systems. Just what we need for a comprehensive exam under the 1995 rules for evaluation and management coding. Let's talk about those 14 organ systems now in 97. You'll see here that 12 out of the 14 match up completely with 1995. Where we have a difference is when we get to the bottom. Here we can actually see that the chest or breast region, as well as the neck, is no longer a body area for 1997, but it's actually going to be an organ system under the 97. So again, for your 1997 exam levels, you want to make sure that you're reading the guidelines in detail. Depending on what level, there are very specific bullets that need to be addressed within each type of the various exams for the specialties. If you're working with 97 guidelines, you're going to know it. Again, 1995 is going to be kind of your default unless you're in a specialized area. All right, that's all I have for you guys. Make sure you're tuning into my next video. The next video is where we're actually going to talk about evaluation and management, medical decision making. So this is going to be the third and final piece for evaluation and management coding or leveling. And it's going to be the most important as well as in-depth. So I'll see you guys in the next video. Thanks. Bye-bye.